Caring for sensitive skin is a topic that's becoming increasingly important as more people seek effective solutions for managing this condition. To dive deeper into how the industry is responding, I'm excited to be joined by two exceptional guests, Dr. Chiedzo Mpofu and Gerry Muhle from Galderma. Both are instrumental in driving forward efforts to drive deeper scientific knowledge on sensitive skin and recognition of sensitive skin as a condition through the Global Sensitive Skin Faculty by Galderma. In this episode, we'll explore why Galderma is so invested in the topic of sensitive skin and what they're doing differently to address the unique challenges faced by those living with this condition. We'll discuss the market trends that have influenced their approach to developing skincare solutions and how they're ensuring that their products meet the needs of diverse populations around the world. We'll also touch on the newest and latest advancements in research, the importance of personalized skincare, and how Galderma collaborates with healthcare professionals to bring effective solutions to people living with sensitive skin. Finally, we'll look ahead to Galderma's future aspirations and goals in advancing the understanding and the management of sensitive skin. Dr. Chiedzo Mpofu and Gerry Muhle, it is great to have you here on the podcast. Dr. Mpofu, let's start with you. Why is Galderma interested in the sensitive skin topic?
Thank you for having us, Hannah. As the pure play dermatology category leader, we at Galderma are committed to advancing dermatology for every skin story. Since our foundation in 1981, we have dedicated our focus and passion to the human body's largest organ, the skin, leading science-based innovation spanning the full spectrum of dermatology. This has led us as a team to make a difference in many skin conditions such as acne, rosacea, non-melanoma skin cancer, and most recently, prurigo nodularis, to name a few. There are other areas that we believe we can make a difference in, and sensitive skin is one of them. And I'll tell you why. Firstly, through our research, we are learning that sensitive skin is a prevalent condition affecting people of all genders, ethnicities, and skin tones, and affecting either the face or the body or both. We're also learning that approximately 70% of individuals worldwide self-report experiencing sensitive skin symptoms. That is quite a high incidence. On top of that, we are learning that 40% of sensitive skin sufferers have no underlying skin conditions such as acne or atopic dermatitis. All of this is telling us that there is a need for appropriate solutions to help people living with sensitive skin, which is why we at Galderma have decided to look more into this area.
Gerry, what is Galderma doing differently when it comes to addressing issues of people living with sensitive skin?
Yeah, thanks, Hannah, and it's great to be here on your podcast, an avid follower, so it's quite an exciting moment. I just wanted to echo what Chiedzo said because we're seeing that there is such an explosion of sensitive skin, and it affects billions of people worldwide. So we had this idea to actually think about how we could forward or move forward with the data and the guidance around sensitive skin specifically, and to really hone in on that. So we developed the Global Sensitive Skincare Faculty, or the GSSF. And one of the things that we wanted to do with that is firstly understand the data and also what innovations can be made. And that started behind closed doors, and it was a great faculty. But we're seeing more and more on social media and online, there's a hunger for more information around dermatological skincare and science. So we wanted to take it out of the sort of academic areas where we had it and give it a brand, give it a name, put it online, have it facing not only the HCPs around the world, but also patients and consumers so that we get accurate data and information out there. So it's really focused on providing that accurate data, that information, and advancing the science on sensitive skin. But what we also wanted to do with it is make sure that we provided this vehicle and that it was truly representative all over the world. So we've pulled together 15 experts that are representative of North America, Latin America, Asia, Europe, and Africa, because sensitive skin is different depending on what sort of skin type that you have. So that's really what we were thinking of doing with GSSF as we started to build that in a platform for sensitive skin.
Chiedzo, how do you prioritize your efforts with the GSSF in the field of sensitive skin?
Well, adding on to what Gerry has said, at Galderma, we have the ambition to broadly deepen and change the understanding and management of sensitive skin. So the GSSF, in collaboration with ourselves, has three main pillars of focus in advancing sensitive skin science. Firstly, we're dedicated to research that addresses knowledge gaps in the area to increase the understanding of sensitive skin. Then innovation. Our research findings inspire the development of new solutions to improve diagnosis and care of sensitive skin sufferers. A notable example is our new Cetaphil gentle exfoliating line, where we are innovating with respect to gentle daily exfoliation and skin smoothing solutions for sensitive skin sufferers. The third pillar is education. We are enhancing the awareness, knowledge, and understanding of sensitive skin. We are doing this for both healthcare professionals and consumers, and we are leveraging social media channels, as Gerry alluded to. You will agree with me that these three pillars of our collaboration with the GSSF demonstrate our commitment as Galderma to transform the science of sensitive skin into actionable insights and practical solutions for physicians and for our consumers.
Gerry, what market trends or insights are influencing the approach to developing skincare solutions for individuals with sensitive skin? And how has Galderma responded to these trends?
Yeah, so for people that know me, the trends and the future world is very exciting to me. We've done a bit of work on aesthetics, and if we dig a little bit deeper on skincare as well, there's a couple of trends that in a recent survey came out. One of them is there's a move towards clean and simple. The days of the 11-step skincare routine, certainly for the younger generations, is dying out, and clean and simple is coming through and being mindful around what we're putting on our skin. There's the rise of men's skincare as well. I mean, something like Harry Styles has just released his own range as well. Diversity is in as well, making sure that you're providing skincare solutions for a broad range of diverse skin types. And that is also why in the GSSF, we have a diverse range of an expert community to help inform us on that. And the need for science on social media and specifically dermatological skincare is a huge trend at the moment. Skin is in, whether it's from the aesthetic side, but even on the skincare side. And that's where providing more evidence, which is what we're trying to drive around sensitive skin, is important. If we hone in a little bit on sensitive skin, we see that in the last 2 years, the number of patients or consumers self-identifying with sensitive skin has increased by around 55% as well. And I think that's also because of the way that the idea around skincare knowledge and science and data through social media is increasing. There's a lot more access to information. And so what we really wanted to drive is make sure that that information was accurate. Because I think I don't need to tell you that when you go on social media, some of the information is accurate and some of it less so. And so we wanted to make sure that tapping into those trends and what is on the cutting edge, that we had the GSSF expert community make sure that they were giving the right guidance and factual information to steer patients and consumers in the right direction, to tap into the trends as we see them continuing to evolve.
Yeah, I mean, misinformation can be so prevalent and so misleading. So we have Galderma to thank for steering us and making sure the information is not misidentified and misinformation. So thank you for that. Chiedzo, can you tell us about the GSSF's worldwide survey profiling individuals impacted by sensitive skin syndrome?
Absolutely, Hannah. Our initial research efforts focused on better understanding sensitive skin. What are the triggers? What are the clinical manifestations? And what is the impact across the world? The Worldwide Profiling Sensitive Skin Survey, conducted in collaboration with the GSSF, is the largest such survey to date. Recently, at EADV 2024, we presented new data from the survey, which included 16,000 participants from across 12 countries in the world. The survey outcomes are leading to a more diverse and inclusive understanding of global trends, as Gerry alluded to, and specific nuances of sensitive skin sufferers, which I think is really important to understand in addressing the unmet need. Through this survey, we looked in detail at the external triggers of sensitive skin and their evolution, and I'm happy to share some of these highlights. From a symptom perspective, itching was the symptom experienced by most individuals having sensitive skin. 41% of participants reported temperature changes as a trigger and a number one factor in their sensitive skin issues. This highlights the significant impact of the environment and climate change on our skin. A new learning indeed. The survey further highlighted the role of lifestyle triggers in sensitive skin, with 45% patients mentioning stress as a factor and 35% lack of sleep, a very strong symptom combination of people experiencing sensitive skin. Lastly, but not least, we saw a higher level of skin sensitivity in people with darker skin tones compared to those with lighter skin tones, which was very unexpected based on the existing stereotypes that people often have in mind when thinking about sensitive skin. So self-declared darker skin tone people reported the highest level of very sensitive skin at 26%, compared to lighter toned people who reported 18%. So these are just a few of the findings that are helping us better understand the variable experiences of patients in different regions in the world and the high unmet needs. The new insights are informing and shaping our product development and personalized care strategies, which is supporting the physicians and the consumers.
Gerry, sensitive skin often requires a personalized approach to skincare. How is this personalized aspect integrated into Galderma's strategies and outreach program?
Yeah, great question. So I think it starts on, I think about two factors really, and one leads off the other. The first thing that we use is a terminology called CTMP, so cleanse, treat, moisturize, and protect. We've also done involved in some research behind that to actually bring CTMP into some practical guidance, and that's being published as well. I think there's been a lot of focus in the past on the T or the treat portion of it, but from a sensitive skin perspective, we also need to be mindful of the cleanse, the moisturize, and protect aspects of it as well. For someone like myself who suffered from acne in their teens and also in their adult life, what type of moisturizer I choose is extremely important, because some will make me break out and some will be the right fit for me. We look to sort of go a little bit further around personalization as it relates to our own product range as well with Cetaphil. And we developed the Cetaphil AI skin analysis tool. And really what we wanted to do was help patients and consumers understand what is the right CTMP approach for them utilizing this artificial intelligence technology, and really provide not only an analysis of their own skin, how dry it is it red, is it inflamed, is it bumpy, etc., and then make product recommendations. When you go into a Target or a Boots in the UK, you're bombarded with a range of skincare choices for you. Cetaphil alone has over 70 different products. So knowing which one is right for you if you're a sensitive skincare sufferer is really important. So with this artificial intelligence tool, we navigated the accurateness around the tool, utilizing a department of dermatology as well to help test. We pulled together 70,000 facial images to be able to inform the tool based on diverse skin types, because as you've just seen from Chiedzo, depending on what type of skin type you're impacted by sensitive skin in a different way. With a simple selfie on your mobile phone, you can take a picture of your face and it will give you a report in terms of what you may be suffering from in terms of different sensitive skin typology, whether it be, as I said, for roughness or dryness, etc. And then it will make a recommendation based on our product range of what the right products are for you. Now, the great thing about AI is it continues to learn. So as more and more people use the tool, it will continue to learn and get more accurate, well, although it is very accurate already. In a recent month, I had a look at the numbers, and in a recent month, it showed that 53,000 consumers in 1 month used the tool. So there's obviously an appetite from consumers or patients to understand what type of skin concerns they have, and then what are the right type of products for them to choose. So I think that's how we're trying to personalize our product range down to a CTMP perspective, but also provide this artificial intelligence tool to help them choose the right product for them as well.
Sounds like you're definitely meeting an unmet need, so that's
Yeah.
really exciting. Chiedzo, can you discuss any recent advancements in research related to sensitive skin, particularly those emerging from Galderma? And how are these findings translating into practical solutions for patients?
Thank you, Hannah. So a good example that I can share is a collaboration that we had with the GSSF, where we described significant morphological changes in biopsies from sensitive skin sufferers in comparison to non-sensitive skin, a very first in the field. These morphological changes seen at microscopic level, either confocal microscopy or optical coherence tomography, included stratum corneum alterations, epidermal hyperplasia, vasoconstriction in the upper layer of the dermis, as well as collagen alteration. This led us to conclude that skin barrier is a primary target for management of sensitive skin, and that skin care must adequately protect, as you were saying, Gerry, and repair the skin barrier, as well as address the underlying neuroinflammation, which can lead to long-term alterations of the skin. So this groundbreaking work has shifted our perspective such that sensitive skin is no longer viewed solely as a subjective condition, but rather as a sensory skin condition that profoundly impacts the quality of life, accompanied by observable changes in skin structure. Really exciting new findings. As a result, physician consultations now benefit from informed questions, for instance, using a specific diagnostic tool, the SensiScore 10, to evaluate the sensitivity skin across 10 questions and targeted advice for managing sensitive skin that takes into consideration external triggers, as I shared before, as well as internal triggers such as lifestyle, as we showed that stress and lack of sleep are important factors involved in sensitive skin. The SensiScore 10, which I mentioned, was published by Professor Misery in 2014. It was validated in 11 countries with nearly 2,000 people with sensitive skin recruited. This tool was developed to better define and assess sensitive skin. It is much more convenient to use in everyday practice in outpatient clinic daily than the available stinging test, for instance. Beyond diagnosis, it is also extremely useful in monitoring the progress made for each patient in managing their sensitive skin. And this is one of the ways in which we are driving practical advancements in clinical practice during consultations between patients and their physicians.
Gerry, from a product development perspective, can you share an example of research related to sensitive skin turned into a new product for patients?
Yeah, I mean, this is where the rubber hits the road, and certainly as it relates back to the GSSF. So we've talked about innovative surveys to really understand the sensitive skin population. We've talked about advancing data. We've talked about new tools, and all of that comes together with working with the GSSF. And I remember in a recent meeting this year as well, we did product development testing with our 15 experts, and they loved it, and so did we, in terms of providing advice on some of the products that we want to bring to the market. And so if I hone down on two products that I'd like to mention, and they really show how we're serious around sensitive skin specifically and how that works out into our innovative development for Cetaphil. Cetaphil will only ever be known as a sensitive skin care product to provide to consumers that suffer from that. So the first one is a product range that is just launched, and Chiedzo mentioned it earlier, around our gentle exfoliating line. And you can imagine a sensitive skincare sufferer probably needs to stay well away from exfoliation, certainly mechanical exfoliation. There's more opportunities with chemical exfoliation. And so really the job or the need that we wanted to solve was how do we provide an exfoliator for sensitive skincare sufferers? So we went to work in the lab, also feedback from the GSSF, to really develop what we call a triple acid complex. So we're using salicylic acid as well as mandelic acid and gluconolactone. By actually having that triple acid complex, you're able to lower the concentrations of the three individual acids, but actually provide a level of efficacy that is similar or still very strong, certainly to provide that exfoliation that you need. We couple that with our core complex for Cetaphil that we're known for, which is panthenol as well as glycerin and niacinamide, which actually helps protect the barrier of the skin as well. So you're providing that level of exfoliation that patients want, but also providing the protection as well at the same time. And in the data that we have, it shows that you could exfoliate with this product on a daily basis if you wanted to. It's that gentle, but also that effective. And so that's just recently launched. It's launched in cleansers as well as face and body lotions. So again, that's really meeting a need for sensitive skincare sufferers who would stay well away from exfoliation. The other area that we've innovated in meeting the need for sensitive skincare sufferers is, I don't need to tell you, I'm sure, but a lot of dermatologists will recommend retinols if you're looking at some sort of anti-aging effect. Again, it's probably not the sort of product that you want to use on a regular basis as a sensitive skincare sufferer. So we were looking at how can we provide an alternative to retinol that is just as effective. And so we came up with our Cetaphil Healthy Renew line, and it's based on a range of purified peptides together with vitamin B complexes in a sort of patented formula. We've also shown in clinical studies clinical superiority to encapsulated 0.3% retinol as well. So here you have a product that works as well, if not better, than a retinol at the 0.3% range, provides that anti-aging effect that you might want as a sensitive skincare sufferer, but without all the side effects that you might get from regular usage of a retinol. So we're really proud of those two because we've managed to solve a problem specifically for sensitive skincare sufferers. You won't see Cetaphil produce a retinol in the Cetaphil brand because it doesn't gel with what you are anchoring yourself on in terms of helping provide treatment needs for sensitive skincare sufferers. So two really great ideas that we worked together with the GSSF and came to fruition in a real product.
Sounds like a really wonderful product line. And I will say I have the first one you mentioned in my bathroom.
Oh, wow, great.
And I've been using it every day. Chiedzo, collaboration with healthcare professionals is crucial. How does Galderma engage with dermatologists, allergists, and other relevant specialists to ensure that its offerings meet the needs of patients with sensitive skin? Can you share any examples of how this collaboration is brought to life?
In a recent US survey published this year, we highlighted that less than a third of dermatology residents self-reported being very knowledgeable about sensitive skin. In addition, while 99% of dermatology residents believe it is important for sensitive skin to be included in their medical education, over half of the residents surveyed do not receive specific sensitive skin education. As part of the GSSF, we have forged a collaboration with the George Washington University in Washington, D.C. to engage in joint research, publications of scientific data, poster presentations, and Congress symposia, as well as a fellowship program directed specifically towards dermatology residents to help bridge that knowledge gap. Also, by collaborating through the Global Sensitive Skin Foundation by Galderma with 15 global experts from 11 different countries, we ensure that there's a closer collaboration with the healthcare professionals, and we also ensure diverse representations and viewpoints included into what we do. As we've seen through our research, the importance of diversity when it comes to understanding sensitive skin. In 2023 alone, we contributed to advancing knowledge on the topic with symposia at the World Congress of Dermatology, the publication of 4 scientific papers, 8 meet the expert sessions at global congresses across the world, and close to 45 e-posters presented throughout 2023. So by sharing insights, advancing research, and shaping best practices, Galderma ensures that its offerings align with the expertise of healthcare professionals, both in research and clinical practice, to address unmet needs. So I'm really excited about the work we are doing and continuing to drive the understanding of sensitive skin.
Gerry, looking to the future, what are Galderma's aspirations and goals in advancing the understanding and management of sensitive skin?
Yeah, so I think you've seen in our conversation today that GSSF is more than just 4 letters. There's a lot behind it, whether it be advancing understanding of the patient and the sufferers themselves through the surveys, whether it be the data that we're producing ourselves in coordination with the GSSF, or also the data that we're supporting through foundational and educational grants and work as well. And that is actually leading to some innovative products onto the market. I mean, the bold goal would be to try and eradicate sensitive skin for sure. But there's a lot of work and it's a journey to get there. And firstly, working to help equip HCPs with the right data and information and guidance. And Chiedzo mentioned some of that just recently. Also, from a patient and sufferer's perspective, really enabling them to be even further informed in the future. And as I detailed earlier, is hopefully that will drive towards meeting the needs for sensitive skincare sufferers with better, efficacious products, certainly within our Cetaphil sensitive skincare range, to meet the needs of what the patients and the consumers need. And I think that's really our goal, is to set out really a stake in the ground that we're going to be all about sensitive skin with the GSSF and working together with them through this public and private partnership, which we feel is very unique, to ultimately get to the goal where we're providing the right products that do meet an absolute need.
Well, Chiedzo and Gerry, thank you so much for joining this conversation today. I learned a tremendous amount, and I will certainly be trying all the products in the sensitive skincare line. So thank you for sharing those with us.